So here's part 2 on how to receive handoff report from the outgoing nurse. So in part 1, I kind of went over the basic information, kind of the introduction of the report, but now we're going to get into the meat of the report. This is the part where the nurse is going to tell you the primary diagnosis and some of the interventions they have done. For instance, if a patient comes in and they have CHF exacerbation, more than likely they're going to get diuresis, and they're going to tell you whether they're on Lasix, how much, they have put out so far, and things of that sort. And then a lot of times when people are coming into the hospital, they do have a primary diagnosis, but they do have a lot of comorbidity. So if they were hypertensive, maybe they went into DKA, they have encephalopathy, things of that sort. They should be telling you what the interventions are. And then once they're done going through all the main things, they should come up with a plan. So when they're like again, if they're coming in for CHF, they're going to tell you the plan, how long they're probably going to be given Lasix. Maybe they were given IV Lasix and ED, and now they're transferring to another form of diuretic. If they have other things, maybe they came in, they have an infection, how long the antibiotics are going to be going on, as far as IV antibiotics, and when they're going to be transferred to PO antibiotics. So they should be telling you what's the plan, right? To kind of give you a sense of, okay, will this patient be discharged today or tomorrow, to kind of let you know what the goals are for that patient so that you can remind the patient. Again, this information will be in the chart, but the nurse should be setting you up with enough information that once you are done getting report, you should be able to go into that patient's room. God forbid if they have a cold or irritate, you have enough information in your mind and for the report to, adequately take care of that patient. Then once that's done, I like when a nurse ends their handoff report and they kind of tell you the discharge. When are they expected to discharge? Where would they be discharging? Are they going to go back home? Are they going to a SNF? Are they waiting to get to a SNF? Do they need guardianship because they can't care for themselves? When is their guardianship hearing? These things should be taking place. Things of that sort. So that's kind of the end of the handoff report. They should tell you when they possibly will be discharged, and if they don't know, they kind of say, we're just waiting for that information. Maybe you can get that on your report, but they should end it on a good report. Now, this is the tip. Once you are done getting handoff report, it is your job. Some nurses like to get handoff report in the hallway or at the nurse's station, but it is your job to go into that patient's room, or if you're already at the bedside, look over that patient. Make sure you see the rise and fall of their chest, because again, now that patient is in your care. So they can say whatever, but they're done at 7:24, whenever the end of your shift is, and now it's your responsibility. And so if you wait after giving report and go do what you got to do, and you come back and a PCA comes in to do vitals and they say they're not breathing, they're going to say, well, Leah, did you assess them? Do you know their baseline? So always look to see if you see the rise and fall of the chest once you get handoff report. And I always suggest that once you get handoff report and you go in and you see the patient, introduce yourself. If all you do is let them see you to know what you look like, tell them your name, then you can go do what you have to do. So yeah, that's part 2. Sorry it took so long, but yeah, that's part 2.